Well, we do know that telemedicine or telecare is something what is inevitable, which is why we need to convince people that there are benefits offered by telemedicine. And this is what we are going to focus on in the next session titled Benefits of Telemedicine. It will be moderated by Piotr Soszyński, strategic medical advisor at Medicover, and our keynote speaker is Zohar Zinger, head of telemedicine department, Clalit Health Services from Israel. And panelists include Łukasz Krasnopolski, CEO of HigerSense, Michał Damczyk, telemedicine director and AI director at MedUp, and Piotr Klimkowski from New Car Diabetes. Piotr, over to you. Well, thank you very much. Good afternoon. It gives me pleasure that we can follow up on this fascinating topic, digitization and development of e-health in healthcare in a broad sense. Today, we are going to put the spotlight on telemedicine and telediagnostic, because this is what we will be focusing on during the next hour. I would like to show you two slides that I've prepared as the introduction to this session. I would like to ask the organizers to run my presentation. Thank you very much. And yes, it's true. Yes, okay, I can control the presentation. Okay, so the moderator introduced participants of the upcoming discussion, so I don't have to do that. Hopefully an interesting introduction on the advancement of telemedicine will be presented by Zohar Zinger, who represents the leading and the largest organization specializing in telemedicine in Israel and worldwide, probably, in terms of digital solutions and telemedicine. Later, together with experts, with Polish experts, we are going to discuss several sample solutions designed in Poland. But before we do that, a short introduction. Why are we talking about telecare and telediagnostics? Well, telemedicine is growing dynamically, especially now in times of pandemic. Also in Poland, we had to quickly shift towards remote healthcare, but it's mainly represented by e-consultations. Well, in Poland, e-consultations are mainly conducted by phone. Worldwide, these are usually video conferences. What works much better, builds much better rapport between the patient and the physician, but because patients and physicians are reluctant to embrace those new solutions, this is only developing. There are also chats in real time and traditional emails. For example, for years, Medicover patients may get in touch with physicians via mail, but you need physical examination to determine the patient's health. What does not always involve physical contact of the physician with the patient to evaluate the condition of throat, hands, etc. There are remote solutions in place. You also need to measure vital parameters, saturation, or measured with pulse oximeter, as well as other parameters which are vital in case of non-communicable diseases such as blood pressure, glucose level, perhaps not in real time, or in case of arrhythmia, the pulse rate. So there are many vital measures that must be monitored continuously over time. And I'm sure we will see major changes in the nearest future. Patients argue that it would be a great benefit for them if telemedicine would embrace and offer remote tests, measurements. We get feedback, direct feedback from patients, and technology is growing dynamically. There are many devices on the market. We'll learn about some of them today during our session. These devices measure certain parameters, support remote checks, and we need to keep in mind that remote education and willingness of patients to engage in remote healthcare is a major factor. It can be reinforced by new technologies, and it plays a massive role, especially in chronic diseases, in management of chronic diseases, because patients usually see their doctors once every 3 months, once every 6 months, and later they have to manage the condition themselves, and very often advice and medication is insufficient, because you need to monitor the ongoing status. So I give the floor to Zohar. Zohar will present the role of telemedicine and the approach adopted.
Give a little bit of introduction. I know that Clalit is the largest healthcare organization in Israel, and without any doubt, a leader in e-health and telecare in Israel and probably worldwide. So we are really looking forward to your presentation. Please.
Thank you very much. So hello, everyone. I'm Zohar. I'm very happy to be here. So thank you for having me. I'll make a short, just to tell you in short story about our telemedicine in Clalit organization. So I just try to move okay. So what we believe in Clalit, that nowadays every patient need to see all the information and to make all the services from his hand, from his little smartphone. Everything's supposed to be here. So we make a lot of efforts to have all of the information of the medical record and all of the ways to talk to your doctors or other therapists through the digital services. So we have many, many services. I'm not going to talk about them because what I really want to talk today is about telemedicine. So as we said before, the Clalit organization is the first one in Israel to start telemedicine services. But today, all of the 4 HMOs, everyone make telemedicine services for their patients. The first telemedicine service we had, it was around 10 years ago. It was for pediatric doctors, and it helped people find the ability to talk to a doctor even in the middle of the night, 2 o'clock, if the baby or the child is sick and need to see a doctor. And of course, you don't want to take your child in the middle of the night when the child is ill to the hospital and there are no doctors during the night. So you can talk with a video chat to a doctor, and the doctor can help you, can give you a prescription for medicine, and or to send you to the ER if necessary. It was very successful. People really liked it. So then we gave them also another service for family doctors, which is also the same, but it's for grown-up people, of course. And then the third one we have was a dermatologist service. This one is more unique because, of course, you can't make all of the dermatologist problem talking to a doctor here. But most of the things, if you have any scratch or a rash or something like that, you can talk to a doctor by video chat. The doctor must see a photo of the problem or to look at it in video chat. Also, we have a very unique machine. This is an Israeli technology. It's called Telecare. Tito is this small machine that you can see here, that you can use it in your home. You have this small device, and the doctor in his office or in his home can see through this device all kinds of things that the doctor can check. For example, the doctor can look into the throat or into the ear, or listen to the heart, or listen to the lungs, and see everything that usually the doctor see in the clinic. Now the doctor can watch it from another place. The patient is in the house using this device, and the doctor is far away in his clinic or office, and he can really check the patient, not only talk and see, but also check, and it's easier for the doctor to decide what to do and what help needed here. So we had all of these services, and then what happened is, of course, COVID-19 arrived this year, and it made a full revolution in all the telemedicine services, I think, around all the world. If before people use it, only the young people or the rich people, only the high society used to use these services. From now on, from this year, everybody has to use telemedicine services because they were stuck at home. If they couldn't go out to the clinic. We had a complete lockdown here in Israel, and people needed to continue talking with doctors. So what happened, you can see the numbers. This is, for example, numbers from March 2020. You can see this was the first of the COVID-19 in Israel. On the first week, we had almost 10,000 people using these services. And then every week it became bigger and bigger. And after 4 weeks, it was much more users and patients using this our telemedicine services. You can see also, if we look at 2020 comparing to 2019, you can see that we have so many users and patients now than we have last year. You can see that in pediatric, we have 1,001% more patients than the year before, and also 150% in family doctors, and in dermatologists, 2,000% more. So in 1 month, people had to learn how to use these services, and some people they didn't think you can talk to a doctor through a computer, and you must to see the doctor. Then suddenly people understood that it is possible to talk to a doctor and get help and get the medical help you need through telemedicine services. This is, you can see, 130% more for all the three services together. Also, we use all kind of home testing. we try that everything you can do in your home without the need to come to the clinic. We prefer you to do it at home. For example, this is a product that we are using. This is also an Israeli technology. It's called Healthy.io, and this allows you, the patient, to make a urine test in your home without the necessity to go to arrive to the clinic. You make the urine test by yourself and check it with the app, and then the doctor gets the test result in the doctor computer. So this is very good for pregnant women, for example, that need to make multiple urine tests and they don't want to arrive all the time to the clinic. And also, especially now, when people try to avoid arriving to the clinics, so this is the best way to do urine tests at home. What's next? We have so many things that we are now planning and we want to do. For example, home testing, like blood tests or food tests, for example. I'm not sure the right English word for that. And everything you can test in your home is better for you and better for the organization. And we try to do all of this stuff. So what I also wanted to talk about is what makes the difference between a successful product or project and between a failure one. Because telemedicine is not a simple thing for both patients and therapists and doctors to apply. Usually people, they are very afraid from new things and new way to make things that they used to do for many years in one way, and now they have to do it in a different way. What we learned, some key rules to make your project, your service successful. The first one is that the product, the technology must be very good without any bugs or any other problems. Because if you have problems in your technology, then both the patients and the doctors will say, this is not working, we cannot use this is not good. In order to have a successful service, you must have a good technology that won't let you down. So this is very important. Another thing that is very important is not only to have a good technology, is also you have to find a way, let the patient understand exactly what he has to do. It has to be simple for using it. Because if it's complicated, then people that are older or people that they don't use so much for Zoom technologies and things like that, they won't be able to use it. And of course, we want everyone to use it. Also the older people and everyone, all the population in the country, we want everyone to be able to use the telemedicine services. So you have to do it very well to find how to write the messages to the patients, for example. So every patient will understand what he has to do, how to take the app down from the app store, and how to get connect to the chat with the doctors and things like that. This is very important because if you start a service that don't have these two major things, you will have a failure. And the problem with failure in telemedicine is that once both patient or doctor tried the service and they decided that it is not good, they won't try it again. So you have to do it good from the first time. Can we measure the improvement? Can you try and check if it's cheaper for you, or if you have better measurements, the medical measurements for your patients? This is not very simple for now. Of course, you can measure it, but meanwhile, when we try and measure it, what we see is that you don't see all of these improvements. But the improvement here, the benefits of telemedicine services is not only to make things cheaper or to make medicine better. For the best thing for the telemedicine services is that they give you a better, they improve the the way that people see your organization and see their medical situation. It's what I'm trying to say. People will like your organization and will like more the doctor if you give them the way to choose. If you let them to choose the way they want to see the doctor, and you give them a better service. And when they start using it, then you will start to see also the benefits of money and medical improvements. But it will take time, so you have to be patient. And how can we decide when it's good thing to go to try the telemedicine service and when this is not good for telemedicine service? For example, if you have an abdominal pain, sometimes telemedicine service is not enough because the doctor have to put their hands on your belly and check you and then make the medical decisions. But more and more things that we see that you can do it through telemedicine services, especially now this year. Sometimes if the patient is stuck at home and can't go outside, so of course it is better to go to the doctor. But if you don't have any other choice, so it's better to talk to the doctor, better than nothing. And we find out that many things that we thought in past that are not good for these services, now we know that they can be also good for telemedicine. So that was short, but this is the time I had. So thank you very much, everyone, for listening. I'm sorry for my bad English. It's because I'm trying to do it quickly. Hope it was interesting for you.
Thank you very much. It was really interesting. I truly appreciate that if you were to describe all of the solutions that you have in Clalit, we will use the whole day of the forum,
yes, exactly.
than just 15 minutes. We will, before we move to the other section, I just want to say that what you wanted to, I understood that you wanted to say that at first what it comes is improvement in patient experience. And later on, there are coming other things: better quality, better, I would say, efficiency, and so on. I truly agree. But if from all of the solutions that you have in Clalit, if you could name just one which made the biggest difference, is there any one that all your patients say wow, or the doctors are really very supportive, or there is no one? There is more than one of such solutions.
I think all of them are good. I think the first one was the biggest change for people's mind to understand there is a new way to make medicine. So our pediatric service, which was the first one, I think is the most important, but also Telecare is a new technology that allows the doctor to check the patient and not only see him. So this made a big change in the telemedicine area.
Thank you very much. Now we will switch to Polish language. Dziękujemy bardzo. Dziękuję.
Okay, thank you very much. It was very exciting, and it was a great introduction to our second session, during which we will be talking about solutions being designed and made in Poland. And like we've said before, we have a very strong expert group. Łukasz Krasnopolski, co-founder of HIGO. We are going to talk about something very similar to Telecare. Definitely nothing inferior. So I look forward to a very exciting short presentation. He will be followed by Michał Adamczyk, telemedical and AI director at MedApp, who is going to discuss solutions geared for chronic patients and designed with acute diseases in mind. And among our guests, we have also Piotr Klimkowski of Nauka Diabetes, and he has a vast experience in telecare provided to chronic patients. So I suggest each one of you takes 5 minutes to make a statement. You all have prepared brief presentations. I don't want to split them into parts. So in your statements, please give us a brief overview of the solution. What is the role that you see in telecare, in telediagnostics, and please share with us if you have any previous experience, practical experience. Have you seen any improvements in clinical results, or perhaps patient satisfaction has gone up? What is the potential? What are the potential benefits for us, service providers, if those solutions are implemented in the future? So Łukasz takes the floor first. And can we see Łukasz's presentation? Hello and welcome. I'm very happy that I have several minutes to present our solution. It's very similar to what we've said before, but I'm very happy that it was mentioned as the solution that contributed most to the change, which had the biggest impact to development of telemedicine in Israel. That proves that the trend is right, and we started with a vision of transforming patient experience in a positive way, of making a difference in our daily life. So it's a pleasure to hear it, that we are aligned to global trends. And Piotr has asked me to answer a number of questions, so my presentation is very brief. We have a single device with 5 modules, galore of functionalities. We can check the throat. It's a dermatoscope, a thermometer, a stethoscope, an otoscope. So it helps diagnose numerous conditions. Can I see the next slide? Because I'm not able to control my presentation. This solution enables us to get much more information than just information from the heart, from the stomach, skin, ear, throat, or mouth, because it supports a very detailed medical interview structured differently, because we offer a much wider perspective, a much bigger insight into patients' health status. We provide a medical professional with information on additional conditions. And what is important, we provide information on recommended tests that need to be taken by the patient. Everything was meant to be simple, friendly for people who are non-medical professionals. So everything has been simplified to a bare minimum. So depending on symptoms, depending on events, the device will receive information which tests are essential. So this puts the patient in much more comfortable situation, because the patient himself or herself is not able to pick tests, and the healthcare professional will have a peace of mind that all essential tests will be done. In real life, what we have done so far and outcomes of the entire development process, because our overriding idea was not to design a device. The device is just a tool. We are pursuing a mission to provide diagnosis in less than 1 hour to any place where our patient may be located. As I'm talking to our business partners, to patients, healthcare professionals, and parents of young children, we have reached a standard that we see a whole set of data, the same data that can be collated during a classic pediatric appointment. Of course, there are some exceptions that require the patient to see the doctor in person, but it's basically one-to-one equivalent. Plus, there are additional elements. The process is standardized. The pace is much faster. So for the patient, you don't have to commute to the clinic, to the hospital, wait in line. And it's much easier and simpler for the healthcare professional, because detection and diagnosis is much shorter than in real life. We avoid the risk of infections, cross-infections from other patients. What is particularly important now, we have data archives, so you can look back previous data, check if any progress has been achieved. So great possibility of data processing. I've mentioned simplicity. The solution must be simple and is simple. So today, when parents who have never done a medical examination before, when we give a HIGO to parents, they are able to cope with it effortlessly. For the first time, they are able to go through the entire process and provide a medical professional with a complete set of data. So key data which are essential for diagnosis. Well, definitely we benchmark ourselves with those two success factors. We know that the product must be good. There is no place for cock-ups, for mistakes. It's a certified device. It's a medicinal product, tried and tested to make sure it's safe. And a lot of attention has been paid to simple details. It does not only come with sleek design, it demonstrates outstanding ergonomics, because you are going to put it into your nose, into your ear, into your throat. So it must be simple, ergonomic, and provide high quality results. So physician-wise, we have noticed that we can talk about our solution. We can argue that it delivers great results, that it's the cutting-edge telemedicine that helps them make a decision and diagnose an issue. But what you really need to do is show them results of the test, of the ear, nose, etc. For example, you see the snapshot of the ear or nose, and the doctor can see at a glance if there is infection or not. So, these are experiences. This is what we have learned. And we've been talking to clinicians, to ordinary GPs, around the corner to have the entire spectrum of experiences of different patient and medical professionals groups. Because, for example, a professor and a local GP pay attention to very different things. So we wanted to get varied feedback. There is a whole variety of benefits, and COVID has certainly added momentum to such solutions. And our device offers savings. It reduces time, shortens decision making. And we also see especially in clinical hospitals, that digitization of the image enables the doctor to see more, take a different decision, make a different diagnosis than during a standard appointment. So it's a new level of quality. Well, I'm not in a position to argue today that telemedicine will provide higher quality evidence. It may, but I'm not sure. But sometimes our device may support prevention because it may diagnose conditions in patients who never visit the doctor. And sometimes the problem can be easily fixed and prevent serious problems in the future. Another benefit, something we've never thought of, but medical professionals have drew our attention, all chronic diseases, which compromise individual immunity. So each time you leave your home, each time you have a medical appointment, you are prone to cross-infections. So remote diagnosis, driven by data, driven by evidence, is very much desired from the standpoint of therapy, which is long, demanding, and you should protect yourself from any risks. And we see massive potential and need, especially on part of patients. Thank you, Łukasz. It was very interesting, and I think it takes us and gives us a whole different perspective of remote tests. 2 short questions. Please tell me, so is the device used by the doctor during the appointment, or is there another way? I know the answer, but I want you to respond. Who performs the test? Is it the patient or the doctor? Well, we've tried and tested it at the beginning, but our findings suggest, and this is something we've been doing from very early on, testing is done at home by the patient without medical supervision, and the patient is able to collate data, is able to perform the test, and in many cases there is no need for any medical intervention. Okay, so this is the real revolution: self-examination followed by diagnosis, because everything is provided to the medical professional. Please tell us when this device will be readily available in Poland. Well, we have launched production, so it's rolling down the assembly line, and we expect that the next quarter it's going to be readily available in your local store. So I think COVID will stay with us until that time. Okay, so right now I would like to give floor to Michał Adamczyk. Can I see your presentations? And please tell us about Karna Life System. Hello and welcome. Well, Karla Life was known as a telemedical platform, and today telemedical platforms are commonly associated with e-consultations. We are taking a step further because our app comes with video consultations module, so you can make an appointment with your physician. But we want to support video consultations with data. And as you've aptly said, this system is mainly used to monitor the condition of diabetological or cardiac patients who are chronically ill. But as you can see, using different peripheral devices shown on the slide and those mentioned by Łukasz, while the consultation lasts, you can perform an examination as we go. You can take your temperature, you can check your oxygen saturation, and while the consultation lasts, you can support the diagnosis with additional results of tests performed at home.
Oczywiście zgadzamy.
Łukasz has mentioned that the additional information is very important. The platform only works with devices that are certified, as this, after all, needs to be credible information provided for the doctors in order for the doctors to take the decision. This is why CarnaLife system is certified medical system with the class 2B. Can be used in hospitals and in surgeries. We can see a whole range of devices that can be used with our platform. It is not an exhaustive list because we are still searching for new devices that can cooperate with our platform. We are building solutions that would analyze data provided by devices. Some of the devices provide very small pieces of information, such as temperature and so on and so forth. But with diabetes, we have patients which take different measurements several times a day, and then this information is gathered. And based on historical data for the patient, we can actually inform the patient and the doctor as to what can be expected. For example, the hypoglycemia algorithms. If we have a cardiological patient, we have algorithms that analyze the ECG results. However, we want to have a more holistic approach towards our patients, and we depart from single measurements, and together with a growing database of patients that monitor a whole range of parameters at the same time, we aim at informing our patient specialists what is happening to a patient and what other parameters need to be checked. So we have patients that come with a single problem, and sometimes we do not see other values, other measurements that may be available because patient has made it. Or thanks to the CarnaLife system platform, we also have information on medicines that are being prescribed for the patient. So a doctor can use our platform to prescribe medicine, but is also able to see the range of medications that the patient is already using, both prescribed and OCT, because patients can actually input this information into the system. They can check for interactions. So that is to the benefit of the patient. So when we speak about patient experience, that has been discussed by the previous speakers, yes, it is very important for the application to be as simple as possible in terms of use. We want it to be encouraging for the patients. Patients need to be willing to use it, because if they take regular measurements, they create a very strong weapon in the fight against the disease. So we can optimize the diagnostics. We can actually reach valuable conclusions quicker. So we have a shorter path to a diagnosis, and we can help the patient to improve his or her health state. So we speak about different devices that measure single parameters, but HygoSense is a multi-parameter device, and we'd be more than happy to make it part of our portfolio. We will be also learning how we could use the data that originates from this device. And we can use it in order to help the patient go through his or her medical condition. And as to the benefits stemming out from using the telemedical multi-parameter solutions, and Łukasz has already mentioned it, it is contactless. Patients can safely contact the doctor, can forward the data to the physician. They can the doctors can also get in contact with patients online in order to send recommendations and monitor these recommendations online. Because, for example, if the doctor asks a patient to check the blood pressure every day in the morning and in the evening, or when he says you should walk or train for 30 minutes, all of this is recorded in the application, so the doctor can actually see that the patient is indeed following the recommendations, which is a simple step towards monitoring patients who have mental problems or psychological issues. And today, due to the lockdown and exclusion of certain persons, their problems have become more severe. So we could try to use telemedicine questionnaires monitoring the level of happiness or satisfaction of a patient. We can actually make sure that these patients are not left alone, they are not left to their own devices and locked at home without specialist care. Well, thank you very much. This is also very fascinating, in my opinion. Systems for such physical tests in a remote way will revolutionize care for such serious problems and very frequent ones, such as infections of respiratory tract. So that will certainly be a revolution. And the system such as the one that you're building will be a revolution for chronically ill. For example, with hypertension, we are speaking about millions of patients in Poland, and I can only imagine that we can move them from sporadic visits to family doctors to daily monitoring, and this can be provided for many patients by way of self-monitoring, and then these patients only need to visit their doctor when it is really necessary. So this approach will really change the way healthcare is provided for chronically ill patients. And now I would like to invite Piotr Klimkowski, who not only create solutions together with his team, but also provides care for patients with diabetes. Piotr has been kind enough to share his experience with us, also from the perspective of service provider. Well, thank you. Can you hear me? Yes, we can hear you and we can see your presentation. So let me just say, my name is Piotr Klimkowski. I represent the Neuka Group, and I will speak about diabetes care. And Katowice usually supports telemedicine and startups. However, not today. 10 minutes before our presentation, in this modern office building, we had no electricity, so I'm not able to use my camera. However, I will try to control my presentation. I'm not able to click it. Well, on the left-hand side, in the bottom, you have buttons that you can click, the arrows, and there you go. Okay, so by way of an introduction, 3 factual pieces of information. So in Poland, we have almost 2.7 million diabetics. So that is 7% of our population, and this number keeps increasing every year. Secondly, in Poland, we have only 1,300 diabetologists. So this is certainly not a sufficient number of specialists, and only 9% of nurses have the time to educate patients on diabetes during their working hours. And I'm afraid during the times of pandemic, this number has decreased. So the support in terms of diabetes telecare, I wanted to show you the example of the diabetes. I'd like to explain what we offer to our patients.
I przejdę.
So I would like to go through a number of elements. So diabetes is a chronic illness, so we need to monitor patients' condition, we need to provide regular prescriptions, and we need to test the parameters. So in the times of the pandemic, when we have limited access to physicians, this is very important. And then again, you do not have to visit a doctor every time you need your prescription reissued. So we can have the e-prescriptions filled out, and then medicines can be collected at a pharmacy. We control the access to the medicines. And diabetes, the very heart of its system is education on diabetes. This education is provided by certified educators. We cooperate with the Polish Diabetes Society. We have a number of modules, and you can see we have pharmacotherapy, physical activity, self-control, diets, complications, lifestyle. All of this is important in order for patients to know how to manage their disease. They need to know that self-control is important, that they have to lead an active lifestyle, that they need to take the medication regularly in order to stabilize the different indicators, both the glucose levels and other measurements. So patients actually normally use a diary where they manually record data. However, they normally do it 5 minutes before entering a doctor's surgery. With our solution, this happens in real time, online, data is credible, and educators actually analyze the data for a given patient. So they are able to look at the glucose levels, their fluctuations, and ask the right questions.
And I would like to share information about Diabetic Care. This is a 3-month-long pilot implemented in cooperation with the local government. It will be completed in Q3, Q4 this year. We have asked all patients what are his or her expectations from Diabetic Care. It was a multiple choice test. More than 78% said they expect more control over their disease. Nearly 60% said a greater sense of safety and higher efficacy of treatment. This is a response given by 50%. And I don't know if you've noticed, 56% are satisfied and 9% are satisfied, and several months later, 79% are very happy with their knowledge of diabetes, 12% are happy, 12% are moderately happy, and 0% are dissatisfied. So these are results of the study. And finally, I would like to quote a very specific example. Female patient aged 55, diabetes type T. She's been struggling with diabetes for 8 years. She's overweight, and 14 days into the program, 79% of tests, glucose tests, demonstrated irregularities, and final 40 days, 98% of results were standard, and weight loss was observed. following discussions with educators, thanks to regular meals, thanks to the right dietary regime, elimination of carbohydrates. So, really the basics. In just 3 months, it improved her results. And on the bottom, you can see statements or testimonials of patients who argue they feel taken care of, they feel that the treatment is effective. An educated diabetes patient means easier therapy. The appointment is focused on substantive issues, not fundamentals. And from the perspective of the National Health Fund, you need to keep in mind that if a diabetes patient is effectively managed, the risk of concomitant diseases is reduced. And you have to keep in mind that diabetes doesn't hurt for many years, and in extreme cases, it's simply too late. Thank you very much. Well, Piotr, your microphone is off. Well, thank you very much. Yes, it was very convincing. When at the end of the day, we see a specific patient case. So it's a very apt summary of this session. We have exceeded our time, so there is no time for questions, but you can see that prospects for telemedicine and telecare are rosy, and I'm sure that in the next 3 or 5 years, and I'm certain they will definitely revolutionize how we are looking after the patients, our outpatients, because we haven't mentioned more advanced monitoring systems, implanted devices. We didn't mention rehabilitation. So many topics which remain relevant, which are on the agenda of telemedicine, of telehealth. Of course, telemedicine poses challenges related to integration, related to system integration with medical records, transition from the old to the new model, new ways of working, but data, their number will be growing and physicians will not be able visually to assess them. They will need to rely on support provided by AI. So I'd like to thank all participants, our guest from Israel, Zohar. Thank you very much. And thanks to you. I hope that during the next edition of the forum, we will have even more time to discuss those topics in greater detail, or perhaps we should have a separate conference dedicated to telemedicine and telecare. Thank you. Well, thank you very much for another portion of use cases, somatic cases. And I would like to recap the session and refer to things we've said early in the day. Is it likely to see the exponential growth? Piotr. Well, thank you very much for very exciting session. I have to admit that some solutions, looked very advanced.